to all of you. Today we will be discussing the anatomical physiological changes of pregnancy. We know that considerable changes occur in the woman bodies as the pregnancy progresses. We will focus on what anatomical and physiological changes occur in the pregnancy. The number one is weight gain during the pregnancy. Now we will focus on the weight gain during pregnancy. The current recommendation of weight gain during pregnancy are an average of 25 to 35 pound. This distribution you can see in this box. The total weight gain range from a single fetus. The baby weight will be 3.36 to 3.88 kilogram or 7 to 8 pound. The placenta size will be 0.48 to 0.72 kilogram or 2 to 3 pound. The amniotic fluid will be 0.72 to 0.97 kg or 2 to 3 pound. And the uterus and the breast size range from 2.4 to 2.66 kg or 2 to 4 pound. The blood and fluid weight increase during the pregnancy is 1.94 to 3.99 kg or 4 pound. The fat storage during the pregnancy is 0.48 to 2.91 kg or 5 to 9 pound. The total weight gain in kg is 9.70 to 14.55 kilogram or 25 to 35 pound. This is a summary of weight gain during the pregnancy. Now let us start discuss on the changes that occur in organ system during pregnancy. Now we will discuss specifically uterus and related connective tissue. Let's start with the uterus. During the pregnancy, the uterus go through a significant transformation. It's increase in size from around 5 to 10 centimeter, or 2 by 4 inch. 2. This is a normal range. How much is it? Its size increase to 25 by 36 centimeter or 10 by 14 inch, becoming about 5 to 6 times larger. Its size become 5 to 6 times larger than normal. Additionally, its capacity to expand by an astonishing 3,000 to 4,000 times, and its weight increase about 20 times by the end of pregnancy. Now let's dive deeper into the changes within the uterus. Each muscle cell in the uterus increase its size approximately 10 times over its original length. Once the uterus expands beyond the pelvic region, it becomes an abdominal organ rather than pelvic one. Now let's talk about the connective tissue that surround the pelvic region. The ligament connected the pelvic organ are more fibroelastic as compared to those supporting the joint structure. These ligaments, along with the facial tissue that contains smooth muscle fiber, provide a crucial suspensory support for the uterus. These are responsible for suspensory support for the uterus. Now we will move onto the urinary system. We will find that during pregnancy, the kidney increase in length by about 1 centimeter or 0.5 inch. During uterine enlargement, the uterus enter the bladder at a perpendicular angle, which can lead the urine reflex back into the ureter. This can increase the likelihood of developing urinary tract infection because the urine stasis. In this urinary system, we discuss kidney and uterus. Now let's explore the changes in pulmonary system. In the pulmonary system, the changes in the pulmonary system is caused by a hormonal influence. The hormone can influence, so the pulmonary system changes occur. The hormonal changes can result in edema and tissue congestion in the upper respiratory tract, leading to increased secretion. Additionally, hormonal induced changes in the rib position occur even before uterine enlargement. This causes the rib flare up and out, increase the subcostal angle. So the subcostal angle is increased. The chest diameter also increase. Due to chest diameter increase, it increase result in rise of 5 to 7 centimeter or 2 to 3 inch. The total chest circumference will increase. These changes not always return to their pre-pregnant stage after the delivery. Next one is a diaphragm. The diaphragm is also affected. It is elevated by about 4 centimeter or 1.5 inch due to change in the reposition. Next one is the respiration. Consequently, the respiratory rate remain unchanged, but the depth of respiration increase. The tidal volume and minute ventilation also rise, but the total lung capacity remain unchanged, slightly decrease. Lastly, during pregnancy, there is 15 to 20% increase in oxygen consumption. This is accompanied by the natural state of hyperventilation, which helps meet the oxygen demand of pregnancy. However, due to increase the work out of breathing, work of breathing, dyspnea or difficulty of breathing may be present with mild exercise as early as 20 weeks into pregnancy. Now, discuss about fascinating changes that take place in cardiovascular system. Let's discuss about blood volume and the pressure. Throughout the pregnancy, the blood volume progressively increased 35% to 50%, equivalent to the 1.5 to 2 liter, and return to normal level around 6 to 8 weeks after the delivery. This increase the blood volume occur primarily in plasma, um, surprising the increase in RBCs, leading to what known as physiological anemia of pregnancy. This is not true anemia, but reflect that greater rise in plasma volume resulting from the hormonal stimulation to meet the oxygen demand of pregnancy. As the uterus size increase, it put a pressure on the lower extremity vein during straining. Additionally, in the inferior vena cava, experience elevated pressure, especially in the spine position, due to compression by the uterus below the diaphragm. In some cases, the decline in the venous return may cause symptomatic supine hypotensive syndrome. As a result of venous distensibility, the blood pressure decrease early in the first trimester, with the lowest level occur around the mid-pregnancy, gradually returning to the pre-pregnant level by about 6 weeks after the delivery. Now let's discuss about the changes occur in the heart. During pregnancy, the heart size increase and the position elevated due to movement of the diaphragm. Heart rhythm disturbance are more common during pregnancy. Heart rate typically increase by the 10 to 20 beats per minute by a full term and return to normal level within 6 weeks after the delivery. Cardiac output experience has significantly increased 30 to 60% during pregnancy, which with the highest increase observed when woman is in the left-sided lying position, reducing the pressure on the aorta. Next, we will focus on the musculoskeletal system, the abdominal muscle, particularly the rectus abdominis muscle on both sides, and the linea alba undergo significant biomechanical changes, stretching to their elastic limits by the end of pregnancy. This result in decreased muscle efficiency and reduced ability to generate strong contraction. The shift of center of gravity further diminish the mechanical advantage of the abdominal muscle. Pelvic floor muscle, bearing the weight of growing baby, experience as much as 2.5 centimeter, 1 inch a drop during the pregnancy. Because these muscle are anti-gravity in the pelvic floor muscle in their anti-gravity position, with must withstand the total change in the weight. Next one is the connective tissue in the joint. The hormonal influence lead to the systematic decrease in the ligamentous tensile strength, causing the joint laxity and hypomobility. Sacrolumbar fascia connected to the abdominal wall is lengthened, reducing the ability to effectively supporting and stabilize the trunk. Joint hypermobility may predispose the pregnant individual to injury, particularly with weight-bearing joint of back, pelvic, and lower extremity. And next one, we let's touch on the thermoregulatory system. During the pregnancy, the basal metabolic rate, heat production increase, requiring an additional intake of 3000 calorie per day to meet the basal metabolic need of pregnancy. The pregnant woman often exhibit a low fasting blood glucose level as compared to non-pregnant. And next one is we will explore the changes in posture and balance. We will explore the fascinating changing in the pelvic, in the posture and the balance that occur during the pregnancy as the body undergo a significant transformation to accommodate the growing fetus. Various adjustments are made to maintain the balance, stability, and overall comfort. Let's start with the center of gravity. With the enlargement of the uterus and the breast, the center of gravity shift upward and forward. The co-contract this shift and maintain the balance. The postural compensation take place, and the lumbar and pelvic lordosis or inward curvature of the lower back and neck increase to compensate for the shift of center of gravity. The shoulder girdle and upper back also undergo changes due to breast enlargement. They become rounded with scapular protection and upper extremity internal rotation. This postural tendency often persists in the postpartum period. It is occurred primarily due to the demand of infant care. The tightness of the pectoralis muscle and the weakness of the scapular stabilizer may contribute to these postural changes, either pre-existing or induced by the pregnancy. Moreover, suboccipital muscle respond to maintain the appropriate eye level and moderate forward head posture, along with the changes in the shoulder alignment. The body may also tend to shift weight toward the heel, leading to tendency toward the genorectovarum hyperextension in the knee in attempt to counteract the anterior pull of growing fetus. It is important to note that these changes in the posture do not automatically correct after the childbirth. The pregnant posture may become habitual. Additionally, various childcare activity can contribute to persistent posture fault and asymmetry. Next, we can move to the next. Let's turn our attention to the balance. As a weight gain, as the weight increase and the body mass redistribution during pregnancy, the compensation are made to maintain a balance. Pregnant women usually walk with a wider base of support and increase external rotation at the hip to accommodate the growing baby. Due to change in the stance and growing baby, the certain activities such as walking, stopping, climbing, weightlifting, reaching, as well as other activity like ADLs may become progressively more challenges. Furthermore, activity requiring fine balance and rapid change in the direction such as aerobic, dancing, bicycling, riding may become inadvisable, especially during the third trimester. In the conclusion of this video, these changes in the weight, in the cardiovascular, in the musculoskeletal, in the pulmonary, in the posture, and the balance are remarkable adaptation that body make to support the developing baby. As a healthcare care professional, it is crucial to understand these alterations to provide appropriate care and support for the pregnant individual.